Hey, I'm Dr. Kate Walker, and today we're talking about questions that you can ask your clients so that they may not come back. And I'm with Jennifer Marie Fairchild, who's going to ask me tough questions like, you mean I pissed them off? Which is a good question. No, we're not going to piss them off. We're not going to do it on purpose. But thank you for joining. I'm so glad you're here so we can bounce these ideas back and forth. Um, yeah, so you ready to let people in?
Yep.
All right, let's do it. All right. So, questions that can help your client get better immediately. So, that sounds like I'm selling snake oil. And Jennifer and I were talking about this before I hit record because I was like, oh, no, we got to do this on camera. Because, so Jennifer, what do you think of when you think of a question that you can ask your client and then they may never come back? Like, I know, like, okay, did I say something to offend them? But like, what else do you think of when you think about that?
I mean, when I when I think of solution focus, like I really go back to the basics.
Mhm.
And it really is about like that miracle question. Like what would your life look like if I waved my magic wand or had a crystal ball? And I think for some clients that opens the opportunity to like, oh, I need to go down this path and work. But I think for some clients, they're like, either they look at you like you're crazy because they don't think that their life will ever look like what that miracle solution is, or they just, I guess, and it's unreachable, or they just think you're silly for even asking that. Like if I had a crystal ball, like I wouldn't be here. So sometimes, yeah, I just kind of go back to the the basics.
I think that's really true. And I think part of that is our fault when we teach it in counselor education programs, because I don't think a lot of educators really believe in a solution focused method. Now, I know there are a ton, and many of my colleagues, the solution focused conference is coming up. This, and believe it or not, this conversation isn't really about even pushing solution focused. But I think as educators, we're like, well, yeah, you could ask them solution focused questions, but for real counseling, you've got to go deeper, right? And so this is where I want to throw my disclaimer out. I'm not talking about being dismissive. I'm not talking about pushing people out the door who have complex trauma or chronic conditions or persistent mental illness. Certainly this is not a one size fits all. And if you've listened to me or watched me or sat with me while I taught a class, I will always tell you this is not, I don't teach band-aids. This is something where if you thought about, okay, what can I ask this client that would help them see that there is a path forward, maybe without counseling, like what would that do to me as a counselor? Like, would I get my feelings hurt? You know what I mean? Would I be like, right? Because a lot of us, even we talk about this in the Texas Counselors Creating Badass Businesses, setting client retention rates as a KPI. And and I'm against that, right? I'm against having, and I'm sure I'm going to get pushback, and I welcome it. As this is a safe space for all kinds of pushback. But the idea that keeping a client is a key to, or a KPI indicating you're being successful. Of course, there is the client that's working on their treatment plan, and yay, they're sticking with it, and they're powering through, and oh my gosh, they're making so much progress. Um, but then we also have an ethical obligation not to overtreat, right? And so I know you've seen the threads like I have, and it's tough. It's a tough sell to counselors who are trying to build their badass practices that thrive, to say, yeah, don't worry about how long they stay. Right? Let's work on the marketing. Let's work on that 10-minute consultation. Let's work on that intake. So I mean, like, if I could give you a magic, well, I'm not going to say magic wand or crystal ball. Let's take off the magic. We're going to turn down the sparkle. What if I could give you a question that would make your client, and I'm choosing my words on purpose, that would make your client better? And you had to open a counseling practice knowing that this question exists that could make your client better. How would you feel?
I feel like that's such a loaded question.
No. You can
I mean,
imagine.
ultimately, you're in the business to help your client see progress, whatever that looks like. And so if they don't, I've had clients who've had trauma and I've had clients who didn't have a lot of trauma. They had a presenting issue. Like if I had something that would help them get better quicker, as opposed to dragging it out for the sake of dragging it out, absolutely.
Yeah. So as a business owner, right? Because you're going to be a business owner here soon, you know, thinking about, okay, how do I base my business then on this idea of 3 or 4 sessions versus 10 or 20 sessions? Like, how does that, and I know I'm putting you on the spot right now, but how would you think about your business then if you really flipped it to, okay, this is how we're going to build it. We're going to count on 3 or 4 sessions.
I think that would change things a lot. I think it would change your marketing perspective too, and the clientele that you target,
Yeah.
because you're not going to market yourself as, a trauma informed, deep diving therapist, because those people are coming to you looking for long term care. I mean, I'm not going to say I specialize in personality disorders because
Right, right.
I mean, I think really I would focus more on the marketing side of things so that I could keep that constant rotation, um, and have a consistent client base that I wasn't stressing.
Me too. Me too. Absolutely. And it's funny because uh, when I got into practice, it was like 2007, 2008, when I really, really, said, okay, this is what I'm going to do full time. And then we had the recession of like 2010, right? I mean, it was literally like 2 years later. And I was cash based. And all of a sudden it dried up. It was gone. And I got on EAPs. I got on like 3 insurances. And I'm just going to own this about myself. I'm not cut out to be a person who files insurance and does that kind of thing. And I ended up getting, it was like a clawback. It was basically one of my clients who said, oh, guess what? You take my insurance now. And they had been paying me cash all that time I was taking their insurance. So they had like a credit for 6 months. It was just, I remember being a new business owner thinking, oh, I am terrible at this. I am just awful at this. And I went to a solution focused conference. And I don't even think it was a full-blown conference. There were a lot of people there, but it was really only 2 or 3 days. And I remember listening to the presenter talk about these questions and how it could help clients see a path forward quickly. And so that was almost like the I'm going to use magic again. It was like a magic moment because it was like I needed something to help me shift my business because I had to get out of the insurance business. I had to get back into cash and help me create a business plan based on exactly what you're talking about, Jennifer, having this pipeline, right? Making sure that I was out in the community, becoming a resource, making sure I was positioning myself as an expert, making sure that I was a go-to person when people wanted to talk on this or a talk on that at the PTO or the Kiwanis Club. And it made my name get out. And so after a while, it wasn't about whether this person was going to stay for 1 session or 2 sessions or 4 sessions. I was full, period. And so shifting to this model, especially, and I'm going to kind of bring it back around to this idea of finances, what we have seen a lot in the threads in our groups is the economy's changing. And with all of these big companies coming around, it's almost like people who are used to this time of year being kind of in a surplus, they're not seeing it. And it was a thread recently. I don't remember if it was in the Badass group or the Texas Supervisor Coalition. And I thought, okay, here we are, right? It's cyclical, right? These things go around, and now we are in a season where maybe our clients that we would rely on with insurance, or that we would say are appropriate for 10 to 20 to 30 sessions, now they're only coming for a few or not coming at all. So I thought I'd pull out the old solution focus thing again, but I'm going to throw in a few other things too. So you already kind of alluded to what's your least favorite solution focused question. That would be the crystal ball magic wand.
Back to basics.
Yes. Um, a few of, I'm going to read off a few that people posted in the badass group. Um, in this moment, what do you sense your body is needing? Uh, what is stopping you? Can you remember a time where this wasn't a symptom? Tell me about it. Imagine how it would look, feel, and how others would treat you if the symptom was better. How have you managed to make it this far? And so is that kind of what you think of when you think of solution-focused questions? How often do you feel like you use them in your practice?
Depending on the client, because I mean, like we've talked about, I work at, an IOP,
Right.
and the way we're structured, we have insurance approval for a year. So that gives me enough time to kind of go through the trauma aspect and kind of like pull out the deep stuff. But as we start nearing termination, I shift to solution focus because I know my time is limited and I've
Right.
got to make sure that they're prepared for this evidence, like discharge in a couple months. So I do switch to solution focused probably about 4 months before discharge. And that gives me a solid give or take with, cancellations and no shows. That
Yeah.
at least gives me a solid 5 to 10 sessions to like, is there any lingering things that you want to, work through? What do you need so that when you leave this program, you feel equipped to go forth and prosper in the world?
So you and the client both have your eye on the exit door at the same time. You both realize that counseling is coming to an end. And so it's almost like the your client is working with you. Like, okay, I will play the solution focused game with you, and I will suppose and I will imagine possibilities instead of where I was maybe 6 months ago when I was still in my trauma. And it wouldn't have been appropriate for back then anyway, right? Because they were nowhere near the exit door.
Correct.
Okay. So then this may turn some people on their ear a little bit, because what we're doing is we're looking at each session as the last session. And I'm talking to you, private practice owner. I'm talking to you, standalone practice owner who's not working in an agency or an IOP. I'm not talking to you who are working with personality disorders and persistent mental illness. I'm talking to you, private practice owner, when you've got somebody who's coming to you, and this may be the one and only time you'll see them. Right. In fact, I remember my professor at Sam Houston State University. I love this guy, Dr. Brune, and he's not practicing anymore, but he was such an influence on me. And he told the class, he goes, guess what the average number of sessions is for a client? And we're all throwing out numbers. And he looks at us and he goes, one. And I remember thinking, oh my gosh, that's so much pressure. Like, I got to hit it out of the ballpark with this person. I've got one session. But it helps you think, okay, if this is the day that I work myself out of a job, what are the words that I can tell this person so that dot, 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 right? And we talk about that in the 10-minute consultation a lot too. It's like, okay, tell me what I can expect in the first session. Tell me what I can expect in the second session. So solution focused questions, but I came up with 3 more. So I'm going to throw this at you, Jennifer. So do you ask medical questions in your intake?
So, like when I'm just doing myself, yes, I do ask basic, are you on any sort of like anxiety, depression medications? Do you have like a history of serious health conditions? Are you under a doctor's care? And if you are, like, is it family medicine or, psychiatric stuff? So, yes, because I do feel like that information is important.
Absolutely. Yes. And I'm going to throw it at you as a way to get them to not come back to your office tomorrow.
Perfect.
Okay. So in private practice, sometimes we'll get somebody who, and you probably know this too, they sit down and you say, okay, well, when was your last physical? When was your last blood draw? And they're like, never. Oh, all right. Or they're going, you're asking all the questions, you get to this part and they say, well, I had a heart attack recently and now I'm on all this medication. You're like, oh, so I'm diabetic, but I don't monitor it well. So you're hearing all these things, or thyroid is another, right? Someone who has thyroid issues or like, approaching menopause, something like that. And you can say to them, stop, do not pass go, do not collect $200 before you come to your next session with me. Go to the doctor and get a blood draw, right? I mean, because you and I can talk our ears off and my mouth off. And if you are still not addressing the underlying medical thing going on with you, whether it's endocrine or it's something to do with the medication that you're on because of your recent heart attack, or who knows, right? I mean, has that ever happened to you in practice where you're just like, wait, what? You've never had a blood draw?
Couple times.
Yeah,
And you're like, oh, or the last time you went to the doctor, I was probably 10 years ago. And I'm like,
right?
yeah, and they'll tell you I'm healthy, but they also say, but I'm pretty sure my blood pressure's high, or I'm overweight, or I'm not sleeping at night. Not sleeping's a big one. The
There.
the
Yes.
insomnia and not being able to stay asleep once falling asleep.
And if we as counselors would, we're not going to practice medicine, so MDs, put your phones down. But if we as counselors could become familiar with the symptoms of sleep apnea, right? The symptoms of, uh, you know, uh, unchecked diabetes, right? So those types of things, uh, like a UTI, urinary tract infection with older people, right? That can often mimic dementia. They we get a little loopy, right? And so as counselors, if you can just become familiar with the symptoms of a physical ailment that mimic and duplicate and exacerbate the symptoms of depression and anxiety. And sometimes, I mean, I worked with so many couples, you'd ask one person and the other one would go, be honest. And then they look at you and go, she doesn't sleep. Or, well, he's got a glucose monitor, but he doesn't wear it. Or, yeah, I can tell his
He's
blood
got a
sugar.
CPAP and he doesn't use
Yes.
it.
And suddenly you're like, oh my goodness, they're about to spend a lot of money on counseling when they could fix this by going to the doctor. Right. So here we are, counselor in good conscience, kind of blowing up our KPI and saying, please go to the doctor first before you come to the next appointment with me. And usually they're excited. I find they're like, oh my gosh, I didn't even think about that. And that's wonderful. And then they come back with all of these results and it's very helpful. Um, so two more questions. The first one, okay, I'm going to pretend like you're my client, Jennifer. If you came and sat down and we're like, hey, how you doing? Okay. And I looked at you and I said, okay, how can I help you today? Silence, silence, silence. As a client, how would you feel?
Like I was put on the spot, and I would
Yes.
probably do what I do every time I go to the doctor, because we are conditioned as a society and as women to be fine and nice and congenial. And so I go into the doctor and they're like, "What brings you here today? How are you feeling?" "I'm fine. I'm fine." And I just smile and act like I'm just fit as a
Uh-huh.
fiddle, knowing that I have a list of a
Hmm.
million things that I was supposed to talk to them about. So I
Yes.
would tell you that. I'd be like, I'm fine. And I'd start to wonder why I even made the appointment to begin with.
Sure. Yes. Did you know, Pavlov's dog, that our clients can actually get cued to become problems focused but by our very office, by the act of pushing the button to go onto Zoom, right? And we know that. We learned that in behavioral therapy 101, right? Ring the bell, the Pavlov's dog salivates. And so if you can start to shift that first 30 seconds, first 2 minutes of your session to how can I help you today? And they recognize, or what would make this a great session today? What do you need from me today? And normalize a client saying, nothing, I'm good. I just didn't want you to charge me the full session because I canceled late. Right? I mean, I've had that happen before. I'm like, oh, so sorry. You want to play cards? No. But right? I mean, because if you went to a counselor and they constantly said, constantly, and you knew you were conditioned that every session you would be greeted with, how can I help you today? What would make this a great session? And again, I feel like I need to put the disclaimer out there. We're not talking about pervasive and persistent mental health issues, right? We're talking about folks who just come in and they're wanting to work some things out. And they answer, well, not much. Would you congratulate them? I would,
Yeah.
right? It's like amazing. You don't need me today, right? So if you're listening to this and you're a new counselor or you're an associate or you're a new graduate, and these questions kind of scare you, right? Because if I'm looking at my client and saying, you got this, you and there's and I'm still here. I make sure to tell them like I'm a click of a button away, right? I'm not going anywhere. But if they say no, I'm good, and we say, yay, good job, you know, that's I mean, that's empowering. That's what we're here for. Okay, my last question. If you were my client and I looked at you and I said, okay, do you want to come back?
I would, I don't know what, I mean, I would probably feel like I needed to say yes, but if you made me feel like I like had the tools already, I just didn't
Yeah.
realize it, no, I might not come back and I'd probably save that fee.
And again, we're back to Pavlov's dog, right? Because so many of us, when they're done with the session, we kind of pivot our chair, we reach for the calendar, we open it up on our, okay, what, same time next week? And if we looked at our clients at the end of a session and said, so do you think you need to come back? Do you want to come back? Again, it's going to be shocking the first time, just like, oh crap, you mean it's up to me? You're the doctor. Now, I'm not a doctor, right? So no, it's really up to you, client. It's really up to you. And do you want to come back? And if they say, well, I don't know, maybe in a month, great. Now, I will say, I have told people, I think you need to come back sooner. And we'll review their goals, and we'll review the treatment plan. And I'll say, if it, especially with addiction and some more persistent issues, I'll say things like, look, if you come to see me once a month for the thing you're dealing with, you're wasting your money. Like this won't work. Right. So we always default to our clinical judgment, our theory, our knowledge of the client's issue, and we preserve their autonomy. That's all we're doing with these questions is we're preserving their autonomy. We're reminding them, we're conditioning them to remember, hey, you've got a say in this too. So I mean, not too bad, right? We had solution focused questions, medical questions. How can I help you today? And do you want to come back? Are there any you can think of, Jennifer? Questions that might make your client not want to come back?
I guess not.
I can't think of any.
Okay. Do you think you would ever use these in private practice?
Absolutely.
Cool. Cool. That's a good endorsement. That means a lot coming from you. All right. I'm going to open it up to questions. So I'm
Oh,
going to pause.
I think Kathy's saying something.
Uh-oh. Kathy, I'm going to hit pause. And